right, guys, so now we are going to move on to different types of abnormal uterine bleeding. Now, abnormal uterine bleeding, we are going to start with menorrhagia. Menorrhagia, okay, is heavy and prolonged, all right? So it's going to be heavy, prolonged bleeding, all right? What are going to be your causes? Your causes, fibroids, uterine fibroids. This is the most common reason, is uterine fibroids. However, you can also have dysfunctional uterine bleeding and hyperplasia. So dysfunctional uterine bleeding, hyperplasia, or an IUD, intrauterine device, which is used for contraception. We'll talk about that a little bit later. All right. Let's see. You are also going to have hypomenorrhagia. What is hypomenorrhagia? Hypo, anything usually means less of, okay? So this is less bleeding, okay? Less bleeding than normal, or spotting. All right? So what happens with this, or what causes this? This is going to be your OCPs, oral contraception, which we'll talk about later, or things that cause obstruction. So if the female has a hymen still, that can cause this, all right? Obstruction, such as a hymen. Metorrhagia. Metorrhagia. What is metorrhagia? Now, meto and meno get confused, all right? So meto is irregular. So this is irregular. Happens in between. You have spotting in between your periods. Okay, so you have irregulars, and it's intermittent, okay? What are your causes for this? Endometrial polyps. You can have cervical or endometrial cancers. Those are the most common reasons. Now, there is something called metomenorrhagia. Okay, so metomenorrhagia. What does that mean? Just, it's a combination of both, right? It's irregular and it's prolonged. Irregular, prolonged, heavy menstruations. All right? The causes for this are going to be your same causes. Cancers, all right? You can have malignant tumors, all right? And your polyps. Cancers, tumors, polyps. Oligorrhagia. What is this? It means your cycles are more than 35 days. All right? This can happen in pregnancy, severe weight loss, like anorexia, or any tumors that secrete estrogen. All right? Tumors that secrete estrogen. Lastly, postcoital. Dr. August, what the heck is that postcoital bleeding? Postcoital means that you're having bleeding after sex. Now, this is one of the most important. Why? Because if you have postcoital bleeding, that means you have cancer, cervical cancer, until proven otherwise. Postcoital bleeding equals cervical CA until proven otherwise. The only other option is atrophic vaginitis. Now, that happens in your menopausal women, and cervical polyps. All right, but you have to make sure that once they have postcoital bleeding, that you check them out for cervical cancer. Now, dysfunctional uterine bleeding. Dysfunctional uterine bleeding is, or DUB, Dysfunctional uterine bleeding is an unexplained abnormal bleeding, unexplained abnormal bleeding. All right. The most common cause is anovulation. So, Dr. August, what's anovulation? Anovulation basically is this. All right. Your ovary produces estrogen. All right. Now, your ovary produces estrogen, and so the estrogen causes your endometrium to grow. However, since you don't actually secrete an egg, there's no corpus luteum. All right? No corpus luteum. Normally, a corpus luteum will produce progesterone. So without the corpus luteum, you're going to have no progesterone. No progesterone means no withdrawal bleeding. No withdrawal bleeding means no menstruation. Okay? But Dr. August, you said it's an abnormal bleeding. So there must be some sort of bleeding. Of course there's some sort of bleeding. What ends up happening is your endometrium, once it outgrows its blood supply, it comes off, and that's the bleeding. So then the endometrium outgrows blood supply. All right? What are going to be your diagnostic tests? Your diagnostic tests are going to be for reasons for anovulation, like hypothyroid, hyperprolactinoma. So you are going to check your TSH and your prolactin levels. All right. Dysfunctional uterine bleeding. The treatment for dysfunctional uterine bleeding, what is it? Well, usually in women under the age of 35, what are we going to do? We're going to give them oral contraceptive pills. Why? Because it gives them the estrogen and the progesterone and regulates the cycle. So you're going to do that. What else? Well, if they have an acute hemorrhage that won't stop, can't stop, no matter what you do, won't stop, can't stop, yeah, you're going to do a D&C. All right, you're just going to clean out the uterus, get rid of all the endometrium. Now, if you cannot control this, you can't control the dysfunctional uterine bleeding, and it's causing significant issues in the patient's life, okay? They're bleeding all the time. What are you going to do? Well, if they're done childbearing, you can do a hysterectomy. Or there's this new thing called an endometrial ablation. You can also do uterine artery ablation. Uterine artery ablation is mostly used for fibroids. Okay? Why? Because uterine arteries, it's done by interventional radiology. Basically, they go in and they clot off your uterine arteries, which decreases the blood supply to the uterus. Okay, when it decreases the blood supply to the uterus, it causes things like fibroids to degenerate. All right. For all of these over here, meno, hypomeno, metorrhagia, postcoital, what's going to be your diagnostic tests? Diagnostic tests, CBC, PT, PTT. Why? You want to make sure they're not bleeding too much and they have no bleeding disorder. And then, really, pelvic ultrasound. You got to see what's going on in there. You want to see if they have fibroids. You want to see if they have hyperplasia, polyps, any of these things. So you want to make sure that you do the ultrasound. Treatment is pretty much going to be the same. Oral contraceptives or any of these things over here that we discussed for DUB. Okay? So, quick overview. Menorrhagia, prolonged bleeding. Hypomenorrhagia, spotting, okay, very little. Metorrhagia, irregular, okay, and in between. Metomenorrhagia, irregular, prolonged, heavy. Oligo means it doesn't happen so much. Okay? The cycles are long. Postcoital, after sex, cancer till proven otherwise. You want to make sure that you check for cervical cancer. DUB, caused by anovulation. All right? Diagnostic testing, CBC, PT, PTT, INR, pelvic ultrasound. DUB, don't forget to add in you're going to do these too, but you want to add in your prolactin and your TSH. All right? What's your treatment? Oral contraceptives. Okay, oral contraceptives. If it's an acute hemorrhage, you can't stop it from bleeding, you're going to do a DNC. If, regardless of treatment, they're still having symptoms, you can do a hysterectomy, endometrial ablation, or uterine artery ablation. One last thing that is extremely important. All right, postmenopausal bleeding, meaning postmenopausal bleeding. They have stopped their menstruation, all right? And then all of a sudden, they had a period. They go, Dr. August, I haven't had my period in 10 years, but in the past month, I had bleeding. I had my period again. What the heck is going on? That is endometrial cancer until proven otherwise, okay? So postmenopausal bleeding, postmenopausal bleeding, that's endometrial carcinoma. And the best and only test is to do an endometrial biopsy. Do endometrial biopsy. All right? We'll discuss that more in the uterus section, but I just wanted to mention it now since it's part of abnormal bleeding. All right, guys, I'll see you in the next section.